Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम जनकपुरी सुपर स्पेशलिटी हॉस्पिटल सोसाइटी नर्सिंग ऑफिसर एग्जाम 2019 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 26. Supervision and delegation is a part of which phase of management process? A. Planning. B. Organizing. C. Directing. D. Controlling. Correct answer C. Directing. 27. Ergometrine is useful in the management of A. Preeclampsia. PPH. C. Eclampsia. D. Twin transfusion. Correct answer B. PPH. 28. Failure of foramen ovale to close will lead to A. Patent ductus arteriosus. B. Transportation of great arteries. C. Atrial septal defect. D. Ventricular septal defect. Correct answer C. Atrial septal defect. 29. Which of the following is not included under cognitive domain in Bloom's taxonomy? A. Analysis. B. Evaluation. C. Criticism. D. Synthesis. Correct answer C. Criticism. 30. Which of the following is not a function of sympathetic nervous system? A. Dilation of pupils. B. Rest and digest. C. Fight and flight. D. Tachycardia. Correct answer B. Rest and digest. 31. Which of the following pathogens causes gas gangrene? A. Mycoplasma. B. Clostridium perfringens. C. Enterovirus. D. Vibrio cholerae. Correct answer B. Clostridium perfringens. 32. Endocephaly of the neurotransmitter serotonin is linked to A. Schizophrenia. B. Alzheimer's disease. C. Parkinsonism. D. Depression. Correct answer D. Depression. 33. A patient with no known allergies is to receive penicillin every 6 hours. When administering the medication, the nurse observes a fine rash on the patient's skin. The most appropriate nursing action would be to A. Administer the medication and notify the physician. B. Withhold the medication and notify the physician. C. Apply calm starch soaks to the rash. D. Administer the medication with an antihistamine. Correct answer B. Withhold the medication and notify the physician. 34. Where is buccal medicine supposed to be placed? A. On the skin. B. On the conjunctiva. C. Between the cheek and gum. D. Under the tongue. Correct answer C. Between the cheek and gum. 35. The method of setting formal guidelines before starting a work is known as A. Assessment. B. Coordinating. C. Execution. D. Planning. Correct answer D. Planning. 36. Which of the following is the immunoglobulin, synthesized by plasma cells, that is responsible for allergic reactions? A. IgM. B. IgA. C. IgD. D. IgE. Correct answer D. IgE. 37. The term OSCE refers to A. Objective Structured Clinical Examination. B. Objective Strategy Clinical Examination. C. Objective Strategy Clinical Evaluation. D. Objective Structured Critical Evaluation. Correct answer A. Objective Structured Clinical Examination. 38. Which one of the following is classified as a halogen disinfectant? A. Alcohol. B. Biguanide. B. C. Bleach. D. Phenol. Correct answer C. Bleach. 39. Amniotic fluid index is measured by A. Leopold maneuver. B. Ballottement. C. Abdominal girth. D. Ultrasonography. Correct answer D. Ultrasonography. 40. The term orthopnea refers to A. Increased rate and depth of breathing over a prolonged period of time. B. Breathing difficulty when lying down flat. C. Gradual increase in volume and frequency, followed by a gradual decrease in volume and frequency, with apnea periods of 10 to 30 seconds between cycles. D. Normal breathing. Correct answer B. Breathing difficulty when lying down flat. 41. Coombs test is performed to predict what complication in fetus? A. Metabolic disorder. B. Physiologic hypobilirubinemia. C. Genetic thalassemia. D. Acute hemolytic disease. Correct answer D. Acute hemolytic disease. 42. The breakdown of protein is facilitated by which enzyme? A. Trypsin. B. Lactase. C. Amylase. D. Sucrase. Correct answer A. Trypsin. 43. Which of the following is not a presumptive sign of pregnancy? A. Urinary frequency. B. Amenorrhea. C. Chadwick's sign. D. Breast changes. Correct answer C. Chadwick's sign. 44. National Youth Day is celebrated on A. 16 June. B. 8 March. C. 12 January. D. 22 December. Correct answer C. 12 January. 45. The process by which molecules of a solvent tend to pass from a less concentrated solution into a more concentrated one through a semipermeable membrane is called A. Filtration. B. Diffusion. C. Osmosis. D. Purification. Correct answer C. Osmosis. 46. Moderate control, motivation, awards, interactive communication, and group decision making are characteristic features of Allen. A. Laissez-faire leader. B. Authoritarian leader. C. Democratic leader. D. Autocratic leader. Correct answer C. Democratic leader. 47. Salt, pickles, and canned soups must be avoided in case of A. Anemia. B. Hypertension. C. Hypoglycemia. D. Rickets. Correct answer B. Hypertension. 48. Who is known as the father of psychology? A. Abraham Jacobi. B. Jean Piaget. C. Abraham Maslow. D. Wilhelm Wundt. Correct answer D. Wilhelm Wundt. 49. Deepak, who has acute psychosis and has been on haloperidol 20 mg for the last 2 days, has an episode characterized by tongue protrusion, oculogeric crisis, stiffness, and abnormal posture of limbs and trunk without loss of consciousness for 20 minutes before being presented to casualty. This improves within a few minutes after administration of diphenhydramine HCl. The most likely diagnosis will be A. Tardive dyskinesia. B. Acute dystonia. C. Akathisia. D. Neuroleptic malignant syndrome. Correct answer B. Acute dystonia. 50. In cold chain the temperature is maintained between A. +2 to +8 degrees Celsius. B. -1 to -8 degrees Celsius. C. -2 to +8 degrees Celsius. D. +1 to +8 degrees Celsius. Correct answer A. +2 to +8 degrees Celsius. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। And don't forget to subscribe. Thanks for watching. See you in next videos.